Yeah, and I know this is really just a tense time kind of for everyone right now.
It is, and I'm really grateful to you for being willing to talk about your experience and, a young woman's experience and what this bill will mean for healthcare. And
Mm.
I'm especially interested in hearing what you think it will mean for Planned Parenthood and what the loss of Planned Parenthood
Mhm.
means for not just young women, but really people across the lifespan, across the country.
Absolutely. And when I think about that, just really the idea that the expansion, how many people it really includes, and from I've had many different reproductive health challenges throughout my life. I had a lump in my breast when I was 14. I had a
Oh,
biopsy, all of these things. I
so
had a
scary.
Yes, an ovarian cyst that ruptured again in eighth grade. All of these things happened to me, and didn't know when it was happening. And thankfully, my parents had insurance. I had a great sexual reproductive health education at my school. And I think about all of the millions of people across the country who don't have that and who are losing that. And when I really think about Planned Parenthood, unfortunately, because of a lot of anti-abortion rhetoric and activism, is this idea that Planned Parenthood is only for abortions, and also that that's a bad thing in the first place, that abortions aren't a part of healthcare, and people.
Sinclair, I'm losing you. I'm losing your audio. Sorry.
Can you hear me
Yeah,
now?
there I can hear you perfectly. Sorry about that.
I'm not sure where you lost me, but I really think about how, because of the anti-abortion rhetoric and the activism, people think that have this very horrible, false idea of Planned Parenthood, and thinking that it's like this place where children go to die, basically, and don't understand how abortion is a part of healthcare and what abortion actually entails. And that even if you don't think you're the person who would have an abortion, you are affected by Planned Parenthood as they offer sexual and reproductive healthcare, STI testing, cancer screenings, um,
Mhm.
things when I didn't even have when I was going through insurance battles when I'm originally from California, I moved to New York City. I didn't have insurance for a little bit, and I was able to go there to get pap smears, to get things that I actually needed, and thinking about how when you're a young woman in college in a place where I didn't have any family, and to have a place where I felt safe and welcomed, where I could ask questions and get the healthcare I needed, and thinking about all the other young women and other people who can't access that is like completely heartbreaking.
You said that so well. And it's one of the things I worry about when we talk about all of these cuts to Medicaid, just dramatically huge cuts to Medicaid, and what that will mean for cutting people out of their access to healthcare. Planned Parenthood already plays an important role in filling in gaps in our fractured healthcare system. If we lose that Medicaid funding and Planned Parenthood, there are going to be so many people who are going to have nowhere to turn. And we're going to
Mhm.
have 17 million people losing access to health insurance. And the implications of that for their health, for their ability to work, for their ability to have healthy, thriving lives going forward is it's pretty overwhelming. And of course, it also hurts people living with disabilities. It hurts older people. It hurts veterans. I mean, the list goes. Kids. Well, almost
Yes.
half of American children are covered by Medicaid in our country. But bring it back to Planned Parenthood, who plays that really important role in filling in some of the holes in our system. It's terrifying to me. And because, as you mentioned, the way abortion care has been so politicized that it has been forced to kind of move away from regular gynecologic care into clinics like Planned Parenthood, they fill that gap, provide that care that will frankly always be needed. As long as people are able to become pregnant, there will be people who want or need to end a pregnancy for a whole variety of reasons, none of which are any of our business but their own. And
Yes.
so where people are going to turn, it terrifies me. My career has been dedicated to taking care of women and girls as an OBGYN. And when
Mhm.
I think about my patients who receive their health care, their health insurance coverage through Medicaid, my heart just breaks thinking about what will become of them. Where will they turn? There will be nowhere for them to turn. And so they will put off screenings, they will put off important checkups, they will not have access to contraception. There will be more unwanted pregnancies. I mean, the list goes on and on. People will have less access to vaccines. This bill scares me so much for the health of all Americans. and your perspective as a young woman and what it would mean in your life and people's like you lives right now is really powerful. And I think it really is helpful to help explain to people why this bill is so damaging. It's so dangerous.
Yes, and I think to really expand the idea of what reproductive and sexual health care is for a lot of people, because still is this connotation and the stigmatization of abortion, and you think that there's a complete there's just like immediate like thought of like sexual reproductive health means abortion, and it doesn't. And the idea of like this is the type of person who has an abortion and demonizing them. And when I had my abortion, I never thought that that was going to be me. I grew up in California. I was always a Democrat, very pro-choice, and it was still really hard for me because it is
Mhm.
very different to be the person advocating for them on the sidelines and then to be the person walking into that space and having to make a choice you never thought you would have to make. And so
Mhm.
to realize that it can affect all of us, people who like I from when I was really little, I had baby alive dolls, and all I thought about was being a mom and realizing that the first time I was going to be pregnant wouldn't be the best time for me at 20 years
Mhm.
old. And to know that people deserve that choice and understanding that how, in terms of our sexual reproductive education and our healthcare, all the options that we need. I have know people in my immediate circle who've never gotten a pap smear because they don't understand what that means because they're scared to go to their doctor. And these are people who have insurance. And to think about other people who might not have insurance now who are losing that healthcare on top of the already this like metamorphosis of like misinformation online when you think about like I think it's like the pink pilling of women who are scared now to go on birth control because
Mhm.
there are all of these like false informations from outlets such as like EV magazine telling women that it's going to cause them psychosis and they're going to lead to more cancer and all of these things and understanding that birth control is life-saving. Obviously, things
Mhm.
can be improved, but I really think a lot of it is about holding two things at once where something can be improved and it can be better and people should have access to things and you don't have to do it, but having that choice also. And that the reason why we have birth control is the reason why I'm here today is my mom could make a choice, her mother could make a choice, and that's
Mhm.
able to have this conversation. And even when you think about the idea that feminism is really losing identifying as feminist, identifying as pro-choice is losing popularity, and really people are confusing about what the definition really is. And feminism is why we're here today. So even if you don't think you're a political person, all of this affects you. If you're not really comfortable talking about sexual reproductive health, that is completely fine because it is personal. So if
Yeah.
it is personal, why are other people to be able to vote on our bodies, on our choices, our lives when they would never meet us? The people voting on this are not going to be in that bathroom with you. They're not going to be in that clinic with you. They're not going to be holding your hand when you're making a really tough decision that is the best choice in this sometimes impossible situations. So when we really think about how intimate it is, how really private it is, that we should be able to leave it up to the person and their doctors to make that choice.
Couldn't have said it better myself. You know, I think a lot about the way people set up their lives. There are a lot of different ways to construct a life. I'm a firm believer that not all women need or should have children. It's not for everyone. But for those who do want to have children, this bill is going to be so harmful to them. It's going to make it so much harder to optimize your health before a pregnancy and then have a healthy pregnancy and then be able to take care of the baby that you are able to then deliver and try to raise. There's been a lot of conversation lately about pushing women to have babies. And it's ironic to me that this bill makes it so much harder for people to make that choice to start a family and raise children.
Yes, exactly. And when we think about how expensive it is to give birth in America, I think it's the average cost is over $18,000 to give birth, and that's without complications, that's without hospital stays. And personally speaking, the risk of being a Black mother in America, the Black maternal health crisis, more than three times likely more to die during childbirth and have those complications, and not having the healthcare now and not understanding the way medical racism really impacts the bill and how so many women now are losing even further protections that they didn't have in the first place is just so harrowing. And so when you think about wanting to be a mother and having that choice and how these choices are even being taken away from you, it has nothing to do with abortion. People who want to build families and having that choice and now are not be able to do that safely.
Yeah, yeah. And thank you for bringing up the Black maternal health crisis. That was something that we were grappling with
Mhm.
before this bill.
Yes.
I'll share with you one of the bills that I'm most proud of that I helped pass when I was in the Minnesota legislature was to expand Medicaid to 12 months postpartum. We actually declared racism a public health crisis in Minnesota, and we had a commission that created a list of kind of a to-do list of things that we needed to do to start to address the crisis and make it better. It's something that has been talked about for a long time. We've been aware of it for a long time, and we have not done a good job of taking actual action steps to make a difference. And one of the really important basic ones is making sure that people have access to health care. And so expanding Medicaid to 12 months postpartum is important. After you have a baby, you're at higher risk for all kinds of things, substance use disorder, mental health challenges, in addition to that huge transition in life to becoming a mother, recovering physically and emotionally. So it's so important that people are able to access care in the postpartum period. Um, and this is talking about taking healthcare away from people, which I fear will make our maternal healthcare crisis and the disparities that exist in them even worse. And we just cannot afford to do that as a country. We need to be going in the opposite direction.
Yes, we definitely, and I so hear you on that, and it's so beautiful that you were able to pass that bill and seeing how it's not just 9 months when you're pregnant. It's not just about that time of care and having that full term of being able to take care of the mother and child during that time. Because when you think about things, like the postpartum depression and all these things that really impact a woman's health post giving birth, and having that holistic care is so necessary, and understanding that this bill isn't just affecting people in a very in a small way. It's affecting people no matter how they voted. Even if they did vote for the current administration, it is affecting them, and they're not having health care. And everyone deserves, no matter who you vote for, what color, blue or red, you deserve to live your life. You deserve to be able to make choices about your own body. And so when you see things in the 6 week abortion ban in Florida and how that's really affecting women there, and most people don't even know that they're pregnant at 6 weeks, and they don't understand how even to track that, or when they're missing their period. And you think about all the other complications you might have before that, whether that's endometriosis or PCOS, and how that might affect your cycle, and then to not know if you're pregnant or not, and how it can turn something that's really unsafe and dangerous for you, and to show that this is really something that connects all of us despite how we vote, what values we have, what we believe in. And it is a fundamental right for all people to have access to be able to protect themselves, to advocate for themselves, and to make decisions about their own lives.
That is so true. And people say if you don't care about politics, politics cares about you, and it impacts every aspect of our lives. So, you don't have to run for office. You don't even have to get super political, but make sure that you do vote, and make sure you understand what candidates stand for. And that's exactly right. As a doctor myself, it doesn't even occur to me. That's the Hippocratic Oath. You take care of the person in front of you. You meet them where they are and try to understand where they're coming from and what their needs are. It has nothing to do with who you voted for or what your political stances are. Your job is to take care of that human being in front of you. And we all have the right to have that kind of care. And so I'm going to do everything I can to make sure that we can start working toward turning this ship around and heading in a direction of more care and more access, so that we can have a healthier country. Because one of the things that really scares me about this bill is I think it's going to make America sicker and poorer overall. And that breaks my heart.
It's absolutely so disheartening, and the stories that I've been hearing when I was just at in DC for the overturn I hate saying anniversary, but the third anniversary of the overturn of Roe v. Wade, and hearing all of these women come together talking about their abortion stories, talking about how they never thought it was going to be them when they had a fetal anomaly, when they were going through chemotherapy, and they had to make a decision between them and the fetus. And I even shared my own story, and seeing the connection that it builds across people who were previously anti-abortion, who were previously not as progressive, and seeing how they've really changed, and by sharing their story and having these experiences. And I remember just sitting there when I was at the Capitol, and I was so grateful to be there. And at the same time, I didn't want to hear these stories anymore. And I was and now knowing that with this bill, I'm so scared to hear more stories. And I'm so scared to hear I'm so scared to not be in places where the women aren't there anymore, meaning that they're not even alive to share what has happened to them, what they were experiencing because they don't have access to healthcare, which is again a basic human right. So we're one of the richest countries in the world. We have billionaires, we have people who could end these crises right now, and there's people who can't even get an OBGYN appointment to understand what's going on in their body.
Well, and it brings me back to the whole reason we are even talking about all of these cuts. The whole reason we're cutting more than $1 trillion from Medicaid and trying to defund Planned Parenthood is so that they can pay for tax cuts for the wealthiest Americans. It's just we're having this conversation that we don't need to be having and we shouldn't be having.
Exactly. And I think this whole defund Planned Parenthood and the idea of being pro-life, when we're cutting healthcare away from millions of Americans, babies aren't going to survive when the mother isn't healthy, when they're not having access and being able to, even thinking about things like SNAP, Head
Yeah.
Start programs. We can't allow these children to thrive even out inside of utero and outside of utero because of the way that this bill is structured. And so this has nothing to do with being pro-life. There's nothing pro-life about this. This is hurting people. People are going to get sicker. And unfortunately, people may die because of this, because they don't have access to all of the basic necessities that they would need to live a healthy, normal life.
Yeah. Sinclair, your voice is so powerful. Thank you so much for sharing your story,
Mm.
and your just really important perspective. I'm so grateful.
I'm so grateful for all the work that you're doing, and that you're in there and you're fighting for all of us and doing really what needs to be done. And I'm just so incredibly grateful for you and the work you're doing and this conversation.
Oh, back at you. Let's stay in touch. Okay. I hope to meet you in person sometime.
Yes, yes, for sure. Thank you so
Wonderful.
much.